Assalamualaikum and hi from Group 5. In this video, we're going to take a look on the coronary artery disease, CAD, in biomedical imaging perspective. This is the content about what we're going to explain in this video, and we're going to take a look on the first one, which is about the disease. So what is CAD? CAD is a branch of arteriosclerosis, which is a common condition where plaque build up in the arteries. In the case of CAD, it is built up in the coronary arteries. So the arteries was blocked by the plaque, and it will restrict the transportation of oxygen and nutrients to the heart, and this may definitely cause death. And in the USA, CAD is the leading causes of death in the year of 2020. There are several diagnosis methods or assessment methods that can be helped for CAD patients, which includes imaging methods and non-imaging methods. There are several tests in imaging methods, which is SPECT myocardial perfusion imaging, PET, CT, MRI. We have also coronary artery calcium scan, which is a specialized X-ray which that help the cardiologists or the doctors to detect and measures the calcium containing plaque in the heart, in the artery in the heart. And we have also the cardiac catheterization and angiogram, where the catheter is inserted into the blood vessel and will be guided by the X-ray to the heart, and the dye will flow through the catheter to help to show up better on the images and outlines any blockages. For the non-imaging methods, we have ECG, where it shows the electrical activities of the heart, and we have also the exercise stress test. In the next explanation, we're going to focus on the coronary CT angiography.
So, moving to imaging modality to diagnose the disease, we have chosen the coronary computerized tomography angiography as the suitable imaging modality to diagnose the coronary artery disease. So, it is mainly to detect the blocked arteries and blood vessels in the heart. It employs advanced CT technology. So, CT angiography diagnoses the cause of chest pain, which is the most major symptoms of coronary artery disease. It used in intermediate risk. So CT angiography is more preferred compared to other devices because it is faster, non-invasive, less risk and reduced recovery time. It has no radiation remaining after the test taken, and there's no immediate side effects also. Cost-effective medical imaging test. Thank you.
Today I'll be explaining the imaging procedure and with the parameters. So first of all, the patient will be requested to remove the metal objects which might interfere with the imaging results. Next, to assess the kidney function, a little volume of blood is occasionally extracted through the catheter or finger stick. Next, the contrast metal is injected at a set rate by an automated injection pump, and followed with the electrocardiogram ECG lead, which is the adhesive patches will be inserted on the chest during the CT angiography of the heart to allow CT scanning to be synced with the heartbeats. So if sedation is required, the doctor will have to determine if it's necessary. So the CT angiography test might be completed in a matter of few seconds. So next, this would be the imaging parameters for the coronary computed tomography angiography. That's all from me. Thank you.
Hello everyone, my name is FAIQ. So next we move on to the patient restrictions that should be considered for this modality. The first one is pregnancy. Why pregnant women cannot perform CT coronary angiography is because the unborn baby may have chance to develop cancer when being exposed to CT radiation. The second one is the patient that has non-coronary artery disease. This patient has an abnormal ECG reading or elevated cardiac enzyme, and it's quite risky and not suitable for cardiac diagnosis with CT scan. The third one is the patient with renal impairments. Why? Because the contrast loss from coronary CT angiography can worsen renal function in patients with underlying kidney disease, and this will potentially lead to contrast-induced nephropathy.
The next patient restriction is about the morbid obesity. This is because the CT scanner table has weight limit, so the person in charge has to ensure that the obesity patient can be laid down on the table without exceeding the weight limit, and also the image quality will be impaired due to the size of the patient. Next is asthmatic patient. This is because they are having difficulty to tolerate with the contrast agent, which will cause a breathing difficulty. So this will degrade the image quality of the CT scanner. And the last but not least is about the allergy, which is about the allergic reaction to the contrast agent. There are two types of reaction, which is the mild reaction and severe reaction. Mild reaction is like sneezing or itchy, while for severe reaction is like difficulty to breathing, drop of heart rate, and so on.
Hello, I am AKMAL FIKRI. Let's proceed to the weaknesses in the current CT angiography in diagnosing the disease. The first one, it has a higher radiation exposure than traditional X-ray. Second, the blur image from the motion produced by the patient. And third, it has 64 slice scanning in the less than 12 seconds. If we increase it more than 64 slices, it will optimize the technique. Next, it does not have the ability to measure the blood flow in the coronary arteries, and the detection of the disease from the CT angiography could not be precise because of the faulty detection of the calcium deposit in all the people. And the last one, small coronary calcification may be missed because degree of luminal attenuation may be matched.